Welcome, everyone. And I'd like to also encourage you to, we'll do some Q&A at the end where you can turn your video on and ask questions. I do believe we have that capability. If not, throw your questions into the Q&A box and we'll be answering those as we go. Looking at the list of participants, I know most of you, but in case I don't, I'm Scott Bogren. I'm the executive director here at CTAA, and appreciate your joining the session today and giving us a little bit of your time. And we've really got a packed house in terms of in terms of content right now. So much happening in DC, a lot happening literally today. We're interpreting a lot of what is in the president's infrastructure proposal. So we'll be able to talk through some of those as well. But I'll keep us moving here. It is being recorded, this webinar, and the materials and all this will be shared with members. We are being held in a webinar format, so feel free to ask questions, as I've noted, through the Q&A. So before we get into the specifics, let's just give you a sense of what's happening right now, and some of the dollar figures attached to what's happening right now when it comes to kind of public transportation policy. And I use the phrase public transportation very broadly. We're coming off and hopefully entering the end game of a global pandemic. That in response to that pandemic, Congress and two different administrations have now invested $69 billion outside of typically budgeted appropriations in public transportation, and we'll go through a lot of that. We had today the president introduce $85 billion in a proposed infrastructure plan for public transportation. It's the first phase of a multi-trillion-dollar infrastructure plan. The first phase focuses on a lot of surface transportation pieces, and I was looking at and reading through the transit piece. It's about, as I mentioned, about $85 billion. We've got the FAST Act, which will expire at the end of September. It's on a extended year, an extension of a year. That is going to be an opportunity to dramatically look at funding and all surface transportation policy. So for those of you in the audience, that means your investment levels, the regulatory environment, new programs, all the pieces that go into surface transportation that get locked in typically for 5 or 6 years. That's being worked on right now. We have the census, and we'll talk about its impact on a lot of things that are going on. We have the House already agreeing that they're going to start taking congressionally designated spending, or as we like to call them, earmarks, are returning. In the House for certain, the Senate really hasn't moved on that yet. All of this happening at the same time. And what it really creates when it comes to public transportation is a very important window of opportunity to kind of fundamentally reshape the amounts of investment in all forms of public transportation, the policies, everything. So it's a critical time right now for you to be engaged. So I'm happy you've joined us today because, as I mentioned, we've got a lot to talk about. So let's talk about with what's been going on the Hill when it comes to COVID-19 stimulus funds. We've had 3 different funding laws passed. We had the CARES Act about a year ago. CARES Act included $25 billion, all at 100% federal. And those funds were largely flowing through normal formula programs. Of that, about $2 billion went to rural, and the rest went to urban. 5307, 5311. To give you an update, as of a couple of weeks ago, we had seen like 99% of that $25 billion obligated, and I believe the number was about 60% of it expended. Almost immediately when the CARES Act passed, there was discussion of the second round of stimulus funding. And it took from April until the end of December to get that done. And that was what you see here as that second bullet under the three separate funding sources, the CRISA Act. The CRISA Act was $14 billion for public transit, but it introduced not using standard formulas, but instead flowing the funds based on how much an agency or a UZA had received in CARES Act funds and comparing that to what it cost to operate that agency in 2018. And what it really resulted in was the vast majority of it, as if you take a look at, we've got some charts that show this in the slideshow that Tony or L'Oreal gave you a link to. What it really resulted in is the vast majority of these funds went to the biggest urban areas. Only 22 of 50 states got 5311 funds, and 1 out of 10 small urban area got any funds out of CRISA. We at CTA were not happy with the CRISA bill. It left too many people out. We immediately set to work to make sure that with, at this point, an incoming administration, we communicated that we try to think simplistically at CTAA. We communicated that transit is actually a national program, and the pandemic and the virus are affecting the entire country. And therefore, we should have, if we're going to invest in transit as a stimulus, it needs to go to everyone. We sent a letter to every House and Senate office in January. We had 267 transit systems signed on to that letter, and they did listen to us. And what we ended up seeing in the American Rescue Plan, though it's very much skewed towards urban, all the small urbans got something, every state got something, which is really what we needed to see. So that takes you to the $69 billion. And that's just a number that we throw out. But take it in context for a second. That is, 4 to 5 times the annual appropriations that we see through normal appropriation cycles in a year. It's a big, big number that's going to have a big impact that we'll talk about soon. So what are we hearing now from Congress and from the Federal Transit Administration? Well, what we're hearing right now is we want every system to spend these monies as fast as possible to prove that they needed it. And I've been trying to pump the brakes on that and try to break the theory that the only way to evaluate a transit system's need in the middle of the pandemic is how fast they're spending these funds. And in fact, the majority of CTAA's members, not all of them, but the majority of them, see these monies lasting several years and are going to need that to offset the local share and other issues that they're going to be dealing with for years to come as a result of the economic fallout from the pandemic. So rest assured, we are trying to communicate on Capitol Hill with the administration. Just because smaller transit systems, both small urbans and rurals, haven't spent all of their money does not mean they don't need it, they don't value it, and that it won't get spent. And that brings me to the bullet I have here on spending plans. It's important right now that you, as transit managers in your communities, are evaluating working, if you're a rural, with your state DOTs, working directly with your funding if you're a small urban, trying to figure out how these funds ought to be spent and flowed from an unusual perspective. And we'll go back up to those top three. The CARES Act, no end date for those dollars. If you got CRISA funding, no end date for those dollars, both at 100% federal. If you got money through the American Rescue Plan, which you most certainly did, those apportionments were announced a couple days ago. We put them on our website. We've communicated about them. Those $30 billion have a 3-year end date. So, all things being equal, you're going to want to spend the American Rescue Plan dollars before you spend, if you have remaining CARES Act dollars or CRISA Act dollars, because of the end dates, all of them at 100% federal. Just a whole set of decision making that is unique to the current environment. So let's move on. Here's an analysis of the overall, when you add CARES, CRISA, and the American Rescue Plan together, here's what you get. 80% of it, large urban, over 1 million population UZAs. 10% mid-size urban, between 200,000 and 1 million population UZAs. Small cities, 50,000 to 200,000. 5% rural, under 50,000. 5%. And then this little sliver here that you see in both the CRISA Act and in the American Rescue Plan, we were able to get $50 million set aside in each of those bills for the 5310 program. Interestingly, there is no unique formula. The 5310 funds, that $100 million, will flow exactly as 5310 funds always flow. The rules and guidance is identical with these funds as what it is for normal 5310 funds. So it has been a crazy year working on these stimulus funding. Again, massive numbers, needed numbers. This has allowed many of you to retain your workforce, to continue serving your essential passengers and taking them to essential destinations. It's been important work that we've all been engaged in, and certainly we've been engaged in here. But I do believe we've kind of reached the end of these stimulus funds. So I wouldn't be banking on additional tranches of stimulus funds to be arriving. Now, that doesn't mean that some of the flexibilities that have been built into these funds won't be built into parts of the reauthorization. I think they may be, but set aside stimulus funds outside of the normal transit and FTA budget, I think we pretty much hit the end of those. So, right now we'll move on. I did want to show you a couple slides just to give you an indication of here's all the rural states and how much money they've received. When again, you add the 3 funding programs, stimulus funding programs together, you can see our friends in Washington State have done particularly well. Here's Texas, here's Massachusetts, here's California. Bigger states did well, but the next slide I think is just as interesting. This one shows, and it compares those 3 funding programs total to FY21 5311 apportionments. And what this shows is certain states, Delaware here, received 16 times its normal annual apportionment to 5311 through those 3 COVID stimulus programs. Washington State tops out at 14 times. The worst a state has done here is 3 times. And that's important for you to keep in mind, that the worst anyone did in rural funding is 3 times their annual apportionment. And I'll leave it to you to decide why you think Delaware did so well. And some of these didn't always make the most sense to a lot of where we were, but it gives you a sense of from the rural piece of the COVID-19. And remember, we're talking about 5% of that total pot. This is what that's equated to across all the states in the country. And both of those charts are in, again, that link that a PowerPoint deck that you're welcome to have and use as you see fit. Let's move on now to reauthorization of the FAST Act, because this is right in front of us right now. So the last year, the FAST Act initially was set to expire September 30, 2020. And as we approached that time in the middle of the pandemic, Congress acted quickly and got agreement. We're just going to extend the FAST Act exactly as it is for another year, which pushed the expiration to the end of September 2021. Well, before they decided to reauthorize, to extend it, the House did a lot of work on a bill, a reauthorization bill known as INVEST or HR 2. And that bill is really the baseline. And I've been talking recently with both the Democrats and the Republicans on the House Transportation and Infrastructure Committee and the staffers that are really doing a lot of the heavy lifting right now. They definitely, both sides see INVEST as the baseline. And so one of the things that I would urge you to do is reacquaint yourself with the INVEST Act. Tony has placed in here our analysis of the INVEST Act. Again, HR 2 if you want to Google it. And you need to look at that and determine, did you like the funding levels? There were increases across the board in all the formula programs. Were you happy with some of the regulatory reform? There's regulatory reform in there for things like procurement, for charter bus regs. There's some good policy in there that I think many CTAA members will like. In talking to the folks that are coming up with, maybe we'll call it INVEST 2.0, they definitely are not reinventing the wheel. The INVEST Act sailed through committee and a full House vote, but that full vote was right along party lines. And what really drove the partisanship in this bill was the Democrats adding in a lot of the green or environmental programs into INVEST that really took the Republicans out of it. Both sides are telling me we're now set to mark up a new version of the House's reauthorization proposal first week of May. That seems optimistic to me, but that's what they're pointing towards. So your House members, now more than ever, if you've got a good working relationship with them, now is the time to communicate your needs, what you liked in INVEST, what you need to see changed in INVEST. We've been doing the same thing. On the Senate side, of course, the Senate always likes to make everything a little more difficult than the House. So the Senate has really two committees, EPW, or the Environment and Public Works Committee. They write the highway title, and the Banking Committee writes the transit title. EPW had a highway title all done last year. They will use that as a baseline, I'm sure, and they're looking at a May markup. Senate Banking is a little slower. I expect to see them ready this summer. So reauthorization, again, 5 years, is going to have to deal with pay-fors, which is always what keeps this from happening. How do we invest? And now into the middle of the reauthorization process, what do we throw? Today, President Biden's announcement of his initial phases of his infrastructure plan, which includes $85 billion for public transit. And he's got pay-fors in this infrastructure plan. He's looking at major changes in corporate taxing. No, right now it doesn't look to me on my first read through it that there is any increase in taxes on any individual, but there's a corporate tax increase. And as they always seem to talk about in Congress, shifting and not allowing of corporations to kind of move revenues to places where they can shelter them from taxes in other countries. A lot of moving parts in this infrastructure bill, and I'll be honest with you, we're still kind of digesting it all, but there is 85 billion in it for public transit. I think a lot of that's going to be attached to the vast majority. It's going to be capital. It's going to be looking at facilities, vehicles, clean, environmental friendly infrastructure. This is where this is headed. There's a lot of discussion in DC right now about how the authorization or the reauthorization and the infrastructure bill are going to work together this summer. I've heard some folks that I work with tell me that the reauthorization is not going to have major increases in funds, but rather will include a lot of policy changes that then the infrastructure bill will fill up with funding increases. That's one person's conjecture on how this will go. I can honestly tell you, we don't know. Literally 2 hours ago, I was talking with folks from the House T&I committee. They had been briefed on this announcement, and they were trying to figure out how will this influence and how will this kind of coincide with reauthorization. It's a fluid situation. It's one that we will certainly have our eyes on, and I can assure you that these two things will at some point connect. It's just very doubtful that if the question is, will in the end the infrastructure bill be the reauthorization bill? Will the reauthorization stand on its own? The infrastructure stands on its own? We don't know yet, but I would, my advice here and my outlook is all these things are talking right now about growing investment in all forms of surface transportation and infrastructure. And, we've long maintained that buses are infrastructure, transit facilities are infrastructure. And you can see that the current administration certainly agrees with that. A couple of concerns. Earlier we talked about $69 billion being spent off budget on COVID-19 just for transit. And then you need to take in the multi-trillions of dollars that have been spent at the federal level to deal with the economic realities that the pandemic has brought on all across all segments of American life. Well, the concern I have is, as you can see, the committees are engaged. They're working up these bills. There's discussion of infrastructure. There is at least emerging some discussions of how you pay for all of this. And the way I like to look at this is a window is opening to get this done. And when does that window shut? Well, we've got, fall of 22, we've got elections coming. And some of us believe we're like never out of an election cycle, but right now is about as far as we can get from an election cycle and be able to work on an issue that we all think is as important as this. My concern is that if for whatever reason, partisanship, no agreement on pay-fors, this window closes, then the results of the next election come in and maybe the Republicans take back either the House or the Senate. And then Congress gets heartache about all of these trillions, let's call it buyer's remorse for all of this money and deficit spending that they've done over the last year to combat the virus. that becomes a really then difficult environment to bring forward a good progressive surface transportation reauthorization that does a lot of the things that we saw in Invest. So I'm trying to give you some insights into my thinking and a lot of the thinking of a lot of people that work these bills, and to give you some insights on why, if you wonder why is CTAA pressing so hard this spring and summer to really get this needle moved, it's because I see that window open, and when it closes, I have a lot of concerns. And I'll be happy, as I said, to entertain questions at the end, I guess, of the session here. No, non-emergency medical transportation, another very important facet to CTAA. At the end of December, the transportation benefit in Medicaid was codified into the statutes. And you may think, well, why is that so important? It's important because no administration can come in now and opt to make the transportation benefit optional at the state level. It has to, any change like that now would have to go through a legislative process, not a regulatory one, which is a much slower and more burdensome process. So we think this is an important success to protecting the benefit, to get it actually into the statutes. It's something that myself, colleagues at CTAA, and others around the country have been working on for years. Along with that, as the benefit was codified into statute, we were able to make sure that public transportation was a part of the way the NEMT benefit needs to be rolled out at the state level. Now, some in transit would like to have seen it be stronger, and it was a tough trade-off, but it is in there. And if I skip down to the last bullet on this page, I can assure you that there are members, particularly on the Senate Banking Committee, who want to see NEMT and coordination redesigned with a fresh look and then brought into this reauthorization process. That's not going to be easy because you've got committees on Capitol Hill, both in the Senate and the House, that deal with transportation. And then you've got ones, for instance, that deal with healthcare, and they don't always work together. The other two pieces on NEMT that I think are really important right now are Medicare, and every year, Medicare, healthcare for seniors, which up to date in its statutes will only pay for ambulance transportation, is moving towards NEMT, non-emergency medical transportation. The majority now of Medicare Advantage plans that a senior can purchase and add to their healthcare coverage, include transportation. We are seeing Medicare approve pilot programs that take dialysis trips and get them out of ambulances and into the NEMT world. And I think we're just seeing a gradual but important understanding of the role of mobility in creating good healthcare outcomes. And we're seeing the for-profit insurance and managed care industries realize that what they spend on a trip is more than offset in the healthcare savings that better access to healthcare creates, that access to exercise, that reduced no-shows at appointments, that better that transportation has a role in creating all of these outcomes. And when you look at the social determinants of health, which is a really popular phrase now in the medical world, mobility, transportation, keep finding their way into that in important ways. So just like in the other pieces, the NEMT world is also poised for dramatic change, and we think dramatic opportunity for public, private sector, for all sorts of folks that are operating in this environment. Two other issues that I wanted to raise is one, the census. We'll have a link here shortly. Chris Zeilinger on the CTAA staff, who really gets census issues, has been following them for a long time. That link is to a 20-page analysis of a Federal Register notice that the Census Bureau put out, that basically they're asking for comments on how they plan on counting and drawing lines. And this census, the census always creates issues in public transportation because a rural area suddenly is part of a large UZA. That happens. A small urban moves to a large urban and loses its ability to get operating assistance. There's all sorts of issues that every census brings. This one has the added wrinkle of the counts for the census happening at a time when we were in the middle of a pandemic. And my concern, and I've raised these on the Hill, I've raised these with the Federal Transit Administration, we certainly are going to raise these in our comments to the Census Bureau, are university settings, where we've got CTAA members who are in small cities that do a lot of trips with university students, and those university students were not in those communities last spring when the counting was going on. And what will the impact of that be? And how do we make sure that's taken into account so we don't get kind of erroneous designations? So there's a lot of census issues that, I'd urge you to pay attention to. And, that, like I said, that 20-page document that Chris put together has a lot of really good information in it. And for those of you who are really into census issues, you'll find a lot there. The last thing is the reemergence and reappearance of earmarks. Congressionally designated spending. These went out 10, 11, 12 years ago now. That Congress has decided they want to bring these back. The House, both Democrats and Republicans, have clearly agreed that they are going to bring earmarks back into both the appropriations piece and in the reauthorization piece. The Senate has yet to determine this. And what's the real meaning of earmarks? Well, one, it's going to place for you an onus on having a good working relationship with your House and Senate offices, who will be the conduit through which you can go after earmarks. There's going to be a lot of rules around earmarks. They're not going to be just done the way they had been done in the past. And you will see those. There's going to be transparency. There's going to be a lot of support letters that are going to be necessary from the community to avoid having problematic earmarks go through. But on the flip side of that coin, what earmarks congressionally designated spending can bring is it is a way to break some of the partisanship that we see. And it's a way to get people to, on both sides, to agree to a project that becomes very important to the community, and ideally then get them to support the overall bill. And it's the reason why, if you look at 2008 and Safety Lou, when that reauthorization was passed, and then all the subsequent reauthorizations, MAP 21 and FAST Act, the last two took time. They had multiple extensions. The partisanship was so rough. The pay-fors were impossible to come up with. We didn't have that previously because we had earmarks. So there's arguments on both sides of it, and I can argue both of them. But the reality is they're going to return. And for those of you who have kind of those projects that fit within this, by all means, it's going to be time to kind of re-engage that muscle memory and re-engage those kinds of relationships. So like I said, I've been talking now for almost 40 minutes, a lot going on right now in DC and a lot to be determined as we move through the spring and summer months. We'll be in touch with all of you. Now really though, I'd like to open it up to questions, and I'm going to turn this PowerPoint off so that ideally you can see me a little bit better. And I'm going to look at the Q&As, and I see some are already in here, and I'm going to answer these, but feel free to fire away with more questions. Jim Moulton, how's it going, Jim? Good to see you. Or read a question from you. Sounds like you're saying we should be pushing our respective federal delegations to close the T-bill, even if not perfect. Well, Jim, I've never seen a perfect bill, and I know you know that. But if we can get this where it has guaranteed funding for 5-year increases across all of the formula programs that you in your systems in Vermont can kind of count on and build on, if we can see the kind of regulatory reform that we wanted to see, if we could continue to see some of the investment in some of the key areas that we want to see, increases in bus facilities, which are really well represented in the INVEST Act. Yeah, we're going to want to get that through and avoid being on the outside when the window closes. And so I don't think that should influence your requests, but I think it should influence our thinking as we get towards an end game. We're not there yet, but we'll get there. And once we start to see real legislation, I think that's how we're going to want to deal with that. Somebody else asks, can you speak to OMB's efforts to redefine MSAs and why transit should be paying attention? Thanks for raising that. If I had $1 for every time I've been asked about the MSA issue, I could probably buy 3 or 4 cups of coffee at Starbucks. There's the MSA issue through OMB is separate from the UZA issue and Census. And so what the MSA issue was saying was, I believe it was moving what they were going to call small urban areas up from a floor of 50 up to 100,000. That will have no impact on FTA's flowing of federal transit funds. All those funds are going to come through the UZAs, and that's where the Census in that document that we had in the chat box for you to download and help us kind of make sure that we're giving the right comments to the Census's proposals are so important. So that's how we've interpreted this. And Chris Zeilinger on our staff assures me that the MSA, how did he say it? The MSA issue, though interesting, is not central to the way transit funds will flow. Julia, good to hear from you, Julia. Do you think funding for rural facilities will require a match? Well, in normal pieces, yes. Now, I'm curious, and I think a lot of us are, that is there going to be a time when we can shift over some of these COVID-19 stimulus funds more easily into capital? And those are all 100% federal. Right now, for obvious reasons, those funds have been used for operations, as they should. But we do anticipate, and I was doing this session for California systems about a week ago, and it was interesting to me that when we opened it up for Q&A, almost all the questions were about what would need to take place to shift some of these funds, American Rescue Plan, CRISA, and CARES, more actively to capital. And then you might have a different piece to it. And further, Julia, CTAA, we're working on it for within certain categories, lowering the local match to 10%. for capital, and moving maybe operating match to 80-20 instead of 50-50. There's a lot of fluidity that we're trying to bring into the reauthorization discussions to get some more flexibility on that local share. So I hope that answers. Peter, have we seen any movement on the reduction of some of the procurement compliance requirements for small transit providers? Yes, Peter, particularly as it pertains to purchase of smaller vehicles. I don't think it's as strong and as thorough as we'd like it to be, but it's progress. And that's a particular piece to look at in that analysis we have of the INVEST Act, and look at it through the prism of your own procurement and determine, does this go far enough? And if not, let us know. And we'll be communicating with both the Republicans and Democrats on the T&I committee to try to say, hey, here's some ways to take that a little bit further. You know, the goal being that, you know, look, procurement, when FTA every year annually gives me a list of the results of their triennial reviews for small urbans and the results of their state management reviews, all of those, always procurement is the #1 hit. And I've used that to say that's because you guys have made this way too complicated. And we've got to come up with ways to simplify these things for smaller transit agencies that don't have 20 people in their procurement office. Maybe it's 2 or 1 in your case. So look through what's in INVEST. It's also known as HR2. Look for how we analyze the changes in procurement, and let Chris on the CTA staff, L'Oreal, our membership director, let us know if it's good, if it didn't go far enough, and how, and we'll tackle it. Kelly, hope things are well in Idaho. Are there efforts to keep the match rates in the authorization at 100% federal, even for, yes, there are. I raised that with the Democrats a week ago. They were kind of contemplating, do we need more money to flow like the previous COVID? And I said, you know, if you could create and lengthen 100% federal for a year or 2 into this next bill, that would be excellent. And we would certainly, most CTA members, not all, but most would probably, if given their choice, would prefer to see it go that direction. But, you know, I do have members that wouldn't want that, but the majority, I think, are going to need that kind of flexibility, particularly when you consider that whereas the federal government can deficit spend, and Lord knows they've been doing it this last year, localities can't, states can't, counties can't, municipalities can't. And, you know, that flexibility for the next 2 or 3 years will be vital in getting us through the pandemic. And I would also urge you, you know, when you're kind of rolling out how you're going to spend the CARES, CRISA, and certainly the American Rescue Plan funds, keep that in mind, that those are all at 100% federal. And again, that's why I've been telling Congress, just because you haven't used it all right away doesn't mean it's not valued and necessary. So great. Any other questions? Oh, LJ, will regular operations still be eligible? Yes. They really, in ARPA, LJ, the American Rescue Plan Act, they really want to focus on operations and payroll. And so, you know, as long as you can justify that your regular operations are moving essential workers, and I know in Concord yours are, and that you are, you know, that would be the way I would go with that to make sure that you're on the right side of that issue. David Bruffy in West Virginia, do you think there will be opportunity to address minimum wage concerns for rural operators? David, I think you and I have talked about this previously, and I do believe, and I haven't seen the details yet, but I won't be surprised if, like in the president's infrastructure package, buried deep down in there somewhere is something that deals with minimum wage concerns. And a lot of CTA members, that would be a challenge, unfortunately. And so I do think that if the trade-off, and I know you've proposed this to me, and I really like the approach of saying, look, if we're going to go with this higher minimum wage, more operating dollars or more operating flexibility for transit systems to be able to do that, that might be a trade-off that we could work with. So, we're gonna kind of look through that and evaluate as necessary. But an important piece. Thanks, Julia. Yeah, rural had a run in the previous administration where we could count on the Trump administration when push came to shove to make rural a priority. I think, whereas we may not be a priority in the current administration, I don't think they're going to look to punish rural or to devalue rural. And that's kind of been the point I've been coming at the new group with is to say, for instance, the low and no emission bus program, competitive funds. I'm working with the Democrats to try to make sure that they put a portion of that aside for smaller cities and for rural. Because the administration, the Democrats want to see electric vehicles, battery electric buses everywhere. Well, you can't have Julia and Heart of Iowa Regional Transit Authority competing with the New York City MTA and LA Metro. These are different types of systems. So if they want to see and drive some of these environmental issues and these cleaner vehicles into rural America, let's set aside funds for it. The CDL requirements, Becky, I'll take a look at that. I don't want to answer that question because that's not been one at the top of my list, but offline, shoot me an email and let me know exactly what you're seeing there. And then I'll react to it, because if there's something in there that you think would really hurt what you're doing in Johnson County and in Indiana, let me know, and we'll try to make sure that we can mitigate that. Yeah, new strategies. Terry, you're right. We are entering a period where we are moving into whatever this new normal is going to be. And we may be doing so, knock on wood, fingers crossed, with significant infusion of resources. And so all of you need to be looking at the funds and the funding opportunities and ideally the growth that's going to be coming your way through that prism of reorienting your service, redesigning your service, trying to determine what operationally have you done in the last year that initially you did as a direct consequence of a pandemic that you have now learned, you know what, that's something I need to continue into the new normal. And how do you make sure that in this transition period, you can really get at that? So it's going to be so important for CTA members to just not reflexively say, hey, the pandemic's over and I'm going back to exactly what I was doing in January 2020. But instead to say, okay, it's a new world. There are new ways that people are traveling. And I've learned a lot during the pandemic, and I need to apply that to the way I need to serve my community. Opinions on the new people at FTA. Gail, they're great. They're engaging with us. They are giving us all sorts of resources. they're acting quickly when it comes to like the apportionment notice for the American Rescue Plan. I think they're going to be really good partners for all of us to work with. You know, Nuria as the acting administrator and ideally, hopefully soon to be administrator, she knows transit. She was in that position at the very end of the Clinton administration. She's run transit systems. She has reached out to me to really talk about what smaller agencies are doing and how they're reacting. And when we've asked them for assistance that, hey, our members need help with X, they jump right on it. So Gail, I think, you know, we're going to have a very engaged, productive partners in the group of people at the FTA and ideally largely at the DOT. If you look at what Secretary Buttigieg is saying, these are things that we've wanted to see a Secretary of Transportation say for a long time. And, you know, before he was Secretary, Pete, he was Mayor Pete. And he wasn't mayor of New York or LA, he was mayor of South Bend, Indiana, a area that is very much like a lot of CTA members. So I'm looking forward to a chance to ideally someday meet him and work with his staff. And we've been working with some of his staff on transportation needs for communities like South Bend. And as long as they have those in mind, I feel very confident that all CTA members are going to be able to move with that. So yeah, I think it's going to be a active and a lot of opportunities here coming at us. Jill, I could say the same to you. We appreciate all the work you're doing in your community in Michigan, and really, you know, all the progress that I'm talking about here is happening because of all the great work that all of you are doing in your communities. There is it's been so great, and I'll speak for all the staff at CTAA, to be able to see how innovative and flexible and responsive our membership has been throughout this pandemic to meeting the needs of their community members, you know, and I don't care if you're Dave Bruffy in Morgantown, West Virginia, or if you're Jill up in Charlevoix County, Michigan. You know, we always kind of have this notion of like our riders are our neighbors, and that's never been more important than it has been the last year. And that grounding that really is at the very foundation of the way we look at public transportation. It's served us so well, and it's allowed us to no one's thrived in the last year, but it's allowed us to continue and to keep working. And so thanks. One other question here, Clark, you mentioned the earmarking will require a lot of support level. Yeah, Clark, I have a meeting tomorrow with House T&I committee leadership, and the only thing on the hour docket is they're going to explain to us in the authorization what they want to see in earmarks. I believe they won't take earmarks until tomorrow, and they have until the 14th of April. As I get a better handle on all those specifics, I'll make sure I share those with you so that you have those, and we'll broadcast those widely. But my sense is they're going to want to see local public backing with letters of support. And that's a reaction to some earmarks of years ago that didn't have any of that never really got funded. And it was just an idea that was put forward, but didn't have really the requisite community backing. And Dorothy, look, Oates, all those counties you serve, all the service you've done to very at-risk populations in the last year, thank you. Anything else? Well, excuse me, as always, you know how to reach all of us. L'Oreal Lance, our membership director, you can reach me directly. My phone number is my cell phone on the CTA webpage. Shoot me an email, I'll get back to you. But engage right now. That's the biggest message. It's the right time now to engage with your members of Congress and make sure that your needs and also that they hear about all the good work you're doing is known, because we don't want to be the best kept secret in town right now. We actually need to stand out a little bit and call attention to the great work that you've done over the last year. So thanks for everything you do. Thanks for joining us. And I wish you all good health and take care.